Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Welcome to All Home Care Matters. Today, we are very excited and privileged to welcome Paul VerHoeve to the show, who is CEO of Mission Healthcare. Paul is joining us today to talk about an important topic that affects so many people day in and day out, and that is why are Americans still hesitant to move forward with home health care? Paul, welcome to All Home Care Matters.
Thank you for having me. Really good to be here.
You're welcome. So, Paul, tell us why you think Americans are confused by home health care and why they're hesitant to move forward with it.
Yeah, it's a great question, and I think it's one that gets asked a lot. I think, one of the very first things that I think is problematic is that, when people start looking into services, it's usually when they need them. And, they're having, some type of a crisis or something just occurred within their family or with themselves. And, that can be really overwhelming as you're trying to figure out what services you can access and what's available. It's a hard time to get educated. So one of the things I think that, we all need to do a better job at is really understanding all of the things that we may need at different points of our lives or the people that we take care of, family members, so that when the time does come, you have a better orientation to what services are available. With home health, I think, historically in healthcare, most of it was really provided in brick and mortar settings, hospitals and nursing homes and doctors' offices and clinics. And that's really how healthcare was delivered for so very long. Now as we see the shift happening within the industry, more and more care is being pushed into the home, which is, I think, aligns really nicely because it really allows folks to be in the setting that they want to be in while they receive care. And then, I think with the pandemic in particular, folks are more apprehensive about being in hospitals or doctors' offices or clinics. And a lot of those services can really happen in the home. So, I think a lot of it's around education and not understanding what qualifies. I think there's also a lot of confusion around what skilled home care is versus what maybe private duty home care may be. They're vastly different as you know. And folks don't understand whether it's something that their insurance covers or whether it's something that they have to pay for. What are the capabilities of the companies? And it really, I think, confuses the senior population on a pretty regular basis. For those of us who work in healthcare, we get so familiar with it because we're obviously living it day in and day out. But for the folks that we're taking care of, the average home health patient is about 73 years old. So when they start accessing services, there's just a real big need to educate on what can be done and how long it can be provided, and how we can benefit them in their home setting. So we think it's going to be something that will continue to evolve. I think the pandemic has helped folks really get a better grasp of what's going on, and what services are available in the home. So we think that this will continue to grow, especially over the next 5 years coming out of the pandemic, and as hospitals and nursing homes are really looking at moving patients to lower cost setting of care, which is really in the home environment. And it's where most of us really want to be if we have the option.
I couldn't agree more. And I'm sure you have many stories like we do. And I would even say it is confusing for seniors, but we have found also, Paul, that there are even healthcare professionals who are confused by it, who are not working in the home healthcare or the home care industry, where, we'll get calls with our business and people will say, well, my doctor just said that I need to call you because I need home healthcare. And, then we're trying to help them with some education, but then also trying to help put them in touch with resources and companies that could provide them with the home healthcare aspect of it. But they'll continue to say, well, no, he said I needed you guys to help me. And we'll explain, but we're not home healthcare. We would if we could. And then the other aspect of it is where Medicare gets involved. A lot of families get very confused by, well, I have Medicare. So, the billing aspect of that part of it is it's really upsetting for us, and as I'm sure it is for you at times, where you're wanting to help these people, but we're not in a position where we can help them with what their need is, but we hope we can help them with at least getting them to where they need to be so that they get access to the help that they need. I think a lot of it starts with patient education in the hospital, in their doctor's office, and if they're in a short-term rehab stay, getting the education there so that they know what resources and what is available to them once they get out, but not only what's available to them, but what they could have access to and how to get access to it. We had a family the other day where the gentleman lived here in our area, but his family was all out of state, and they were supposed to have a discharge plan meeting on that Monday. Well, this was a Friday. He's calling us. Well, his doctor said, well, he can go ahead and be discharged today, but the only way he could be discharged was if he had support when he got home. Well, his family wasn't coming into town until Sunday, planning for that Monday discharge. And we said, you need to talk with them about, properly preparing you for a discharge. And we actually just did an episode on that because of that very reason, what questions to ask and how to prepare for that discharge. Because like you said, when you work in the healthcare sector or you're in the industry, a lot of this stuff, sometimes you can almost take for granted that, well, everybody should know this. But if you're not in it, you don't know it. And I love what you said, because we say this all the time. A lot of families aren't aware of what's available or how to do things or how to gain access to things until it's a critical moment that they need to know. And then they're left scrambling. We get calls on, Christmas Day, Easter Day, Thanksgiving, where somebody's being discharged and they have no support to go home to. And they're left kind of, I need a ride home. I need help with this in the morning. And, it's really tragic, because I think, like you said, with the pandemic, one, if there is a good thing to come out of this horrible situation, is maybe people are becoming more aware of what's available to them and how to gain access to those things. Because most people are very unfamiliar with home care, and even to a certain extent, even home health care. A lot of families, if the person is non-ambulatory, but they need to go to PT 3 times a week, they're not even being told that, well, have you considered home health care as an option to have them come into the home? And, that's such a huge support to these families. And a lot of them aren't aware that it's existing until somebody they come across, whether it's us or, with you or whoever it is, and says, well, why don't you guys look into home health care as an option? That way you don't have to leave the home. That's a great thing, but they aren't aware of it until the time happens. And that's one of the reasons we do All Home Care Matters, is just to try to provide families with these informational resources and, topics that, if it helps one person, we're happy.
It's really refreshing to hear too. I think, one of the things that we all do, because you're right, when a senior or a family member calls, they need help, and they need some type of help. And it may not be what your individual organization provides, but I think, having good networks of resources, it's a part of our responsibility as healthcare providers to make sure that we can help educate, even though the patient may not be accessing your specific services, and, kind of almost like care coordination. And, if companies take that approach, when you think about, the patients that we're taking care of, they're really looking for information. And if we all do the same thing, recognizing that there's a lot of us that are a part of taking care of patients in the home, I think the patient ultimately gets, the best care, and they get the right available services. And, as there's a lot of confusion around home health and home care or private duty. And in many cases, they qualify for one, or they qualify for both. Or they use both. And, folks don't quite understand that that home health, skilled home health, really is, tied to, a skilled need that they may have, something that's very nursing related or physical therapy related. And it's for a short period of time, and you have to be homebound in order to receive it. And Medicare does pay for those services, so there's no out-of-pocket expenses. Because I know that we get a lot of asks from us around, hey, can you help us with, bathing and getting up in the morning, and maybe making some meals, or doing some, some household items, the things the activities of daily living that, really patients need on a day-to-day basis. And we partner with a number of different home care companies, private duty companies, to be able to meet that need. And I'll tell you, when companies come together to do the best for our senior population, it's usually when they have the best experience.
Absolutely. Absolutely. You know, a couple of things as you're talking, I'm thinking, you know, we had gotten an email recently where a daughter lived more towards our UP population here in Michigan, and her mother lived down in the Metro Detroit area where we're located at. And we'd been helping the mom a couple days a week for several years. And it got to the point where we're suggesting and recommending you may need to think about some more help for your mom. You know, her dementia had really advanced and we were very concerned about her safety. And unbeknownst to us, the daughter had, you know, gotten her admitted into under hospice care. And she had called and spoke to one of our case managers and said, you know, I just want to let you guys know next week, hospice is taking over the care and they're going to be taking care of mom 24/7. We're not going to need you guys anymore, but we thank you so much for everything you've done. We're so appreciative. And at the end of the conversation, we said, well, we might not be going anywhere yet. You might want to check because hospice won't be with your mom 24/7. Well, she's convinced, oh, yes, they will. We said, well, they may have meant that she'll be under their care 24/7, but not necessarily physically under their care. And the daughter was convinced. And, you know, you can't fault them because it's one of those things, you don't know what you don't know, you know, and it can be very convoluted and it can be very confusing. And the next day she was having the assessment and the intake with the hospice provider. And she called that afternoon and said, guys, I think I'm going to need your help 24/7 because hospice explained. And we said, not a problem. And she's like, this is so confusing to me. She goes, when they say mom's going to be under their care 24/7, an average person would probably assume the same thing. And we said, you know what? It happens all the time. And then recently we had gotten an email from one of our episodes where a son lived out of state, mom lived in a different state, and was asking questions and said, how come Medicare won't pay for my mom's care? She needs help with 3 of the ADLs, and I'm reading Medicare guidelines, and so it doesn't make sense to me. I said, well, does she have long-term care insurance? Yes, she does. I said, well, now why would long-term care insurance pay for her care if Medicare will provide for it? I go, long-term care, you have to meet those ADL requirements. And if Medicare will pay for it, there'd really be no need for long-term care insurance. And, you know, emailed back and he said, that's a really good point. He goes, then what is, you know, so, you know, gave him some information, a couple links and explained it. And he's just like, man, you know, I'm an educated person, but this just is beyond my comprehension. It's really confusing. And I said, you know, look at it like this. The home health care sector, whether it's hospice, home care, home health care, visiting nurses, visiting physicians, they're a body. Your body won't function independent with one without the other. You can have a left arm and maybe you don't have your right, but they can also work together, but they don't work against each other. So every part has its specific role that gets played. Some have different guidelines than others. And then it just depends on what your needs are and, you know, what you qualify for and things like that. But one doesn't have to be and not the other. I said, we have families we help, they have home health care and they need the home care aspect. We have families who have the home care, but they don't need the home health care. You know, they can work together or they can work independently. And, you know, one thing that we're very passionate about as you, Paul, is having that education, just making people better aware, because so many people, I think, would make different choices and choices that they may prefer over the choice they ultimately choose if they knew that it was an option, if they knew it existed. You know, I mean, we talk with families that never even have heard of home health care or home care, you know, and they think, you know, if you go into hospice, you have to go into a facility and that's it. You know, they don't realize hospice will come to the home, you know, so it's just, like you said, better awareness, better education, and just getting the word out there so families are aware that these options are available. You know, one of the ladies that works here with us, she had said, had the family known, this was only 10 years ago, that home care and home health care was an option, their mother would never have gone into a facility, never would have. You know, she was in the house they raised their family in, and she wasn't really bad off, but she preferred to stay in their home. But they were concerned that she would need too much help here and there that she could live on her own, and she could have stayed there for the last 10 years had she had known, but they weren't aware of it. And nobody at the doctor's office, nobody, no one had ever made them aware that these types of resources are out there for them to take advantage of, so I'm glad to hear you're helping to educate people, because that's one of our biggest passions.
You bring up a really good point, and I think there's been some changes within the healthcare system too. We'll call it the old days, where you and your family went to your primary care physician, and as things happened to yourself or to your family, that doctor would see you in the office. They would see you if you were in the hospital. They would see you if you were in the nursing home, and they would really kind of follow the care. And I think, in today's world, we don't see that type of physician following throughout, kind of the care continuum. So a lot of times, the relationship is with the primary care physician, who, when they end up in the hospital or in the nursing home, they're not really having interactions with. They're usually dealing with another physician. And I think that that's where, some of that communication stream really can break down for. I apologize, my lights turn off here if they don't sense enough movement. They really, it breaks down the communication path with, I think, a lot of patients. And so many times the primary care physician doesn't find out that maybe somebody went to the hospital for weeks or months on end before they find out. And, that's really who patients trust, is their primary care physician. And I think nowadays with, the way that clinics work and the way that insurance works, doctors are seeing lots of patients, and a lot of times you're seeing maybe the nurse, you're seeing the doctor, sometimes you're seeing, maybe a medical assistant, and you don't have the opportunity to be there for a half hour to really kind of ask all the questions that you may have. It's very pointed. So I think that's added some challenges with what services are available.
Right.
I think the great news is that I think all of us, when people ask us, where do you want to be when you're receiving any kind of care, and if home is really the option for almost everybody. And
right.
I think the pandemic has brought a lot more awareness around services that are available in the home, because folks are apprehensive now about accessing care even outside of their homes. And I think that that's really a positive thing for home care and home health and other companies that provide services to seniors in the home environment. I think you're absolutely right. That story is a great one. Most folks, have lived in their homes for long periods of time, and, there's a lot of pride of ownership, and, you can just tell by the pictures that are hanging on the wall, the memories that they have. In many cases, they've raised their children in those homes, and, 40, 50 years worth of memories. That's a really tough decision for a senior to leave that and then go to a completely new environment. It can be extremely depressing in many cases.
Right.
A lot of times it's not what they wish to have. And you're absolutely right with the services that are available today in almost all communities, between home care and home health and, nutritional services and all the other things that are out there that can come to the individual in the home environment. I think folks are really going to be pleased with the ability to kind of age in place.
Yes.
And it's something that we focus on quite a bit. Is aging in place is something we all want to strive towards. And I think that the availability of services are going to continue to grow in the home, because you're also seeing, there was a time where patients used to go to the hospital and they'd be there for a week or 2 weeks. Nowadays, if you go to the hospital, you're there for sometimes not even a day, sometimes maybe 2 days. But those stays are shorter, and those patients are now going home with more services than they had historically too. So the healing process tends to happen, more in the home today than it probably did 10, 15, 20 years ago.
I agree. And I also think the healing process is more successful when it's taking place in the home rather than in a facility. Statistically, people are shown to thrive better. Now, when you also add into the discussion a person with dementia, putting them in an unfamiliar surroundings, then they're shown to have a drastic decline in their health, and in the progression of the disease is accelerated because it's terrifying to them. We explain to families, with dementia, it affects your short-term memory. The last thing is your long-term memory. People can tell you the street they grew up on. They'll have memories of their childhood, the home that they raised their family in. But if you put them in a new building, say this is your room, they will never have the awareness to learn and feel comfortable there. And a lot of them tend to shut down. They just, something inside them gives up, so to speak. But you keep them in their home, it's not going to erase the progression of the disease, but they will thrive and live more successfully and healthily while they're in that familiar surrounding, because they feel safe, they feel secure, and it's familiar to them, even though they may not remember who came by to visit the day before. It's a sense, it's like a security blanket. And we see that with so many dementia individuals. It's heartbreaking, and then even just a short trip to the ER, if they had a fall or something, was giving them issues, or their health was bothering them, or they felt sick, just that short trip to the ER just throws off the next couple of days for them, because they can't comprehend and, absorb that change. And so I always like it when families, when it's possible for them to remain in their home as long as possible, especially when you bring dementia into the conversation.
Absolutely. And, I think on the skilled home health side, what we see is, when patients were really kind of rehabbing more in a nursing home or a rehab facility, or even in the hospital, and then they would go home, a lot of times they wouldn't have services available. And, the reality is, when you're in a hospital or a nursing home, everything is set up for you to be able to function accordingly. When you get to your actual home, and you think about getting in and out of the shower, or getting in and out of the restroom, being able to get up and down off of a couch, being able to maneuver, stairs if there's any, those pieces are really important to have the care in your home, so that, you're able to really function at the best level possible. I think that's one of the things that folks kind of forget is, somebody does really well in a rehab facility, and then they go home and then they struggle because they just don't have everything that you would have in one of those institutions. And, when you can have skilled home health come in, and, you think about the therapist who are, helping with positioning and how to get up and down, and how to be able to maneuver in the kitchen, how to be able to maneuver in the bathroom, how to get in and out of bed safely. Those are really big components of not just the patient getting better, but also hopefully avoiding any potential issues that could come from, another fall, or something, could occur that would be extremely negative, that puts, potentially the patient back into the hospital.
Absolutely. And I know one thing for us, when we're helping a family and they have home health care coming in, quite often the physical therapist or the occupational therapist will go on the days that the care staff is there, and they will say, today I want to take you through and train you, because I'm coming 2 days a week or 3 days a week. And I want to make sure on the days I'm not coming that they're still doing those strengthening and those coordination exercises, because they'll lose any progress. Because if they're just doing it on the days I come, eventually my visits are up and I'm not coming anymore. I don't want to see them revert back to where they were pre their fall or pre-injury. So I think it's also important to have somebody there to kind of make them accountable, make sure that they're doing those exercises and encouraging them, especially if they've had a painful surgery or a painful injury. A lot of times, well, I'm sore, I don't want to do it today, but I'll do it tomorrow, kind of like, the excuses. Yeah. And just having that positive encouragement, really makes a tremendous difference, and that's what's nice about having that physical therapist or that, occupational therapist or home health care coming, because they can see that progress. And then they also know that, okay, on the days I'm not here, this person's getting this done, and they're continuing those exercises. So we're seeing great strides. And a lot of times they'll leave like the advanced next stages of the exercises when their visits are up, so that, they're leaving with a good feeling that, what, this person, we did our job. We got them back to their baseline. We got them improved, and they're going to keep on it, because now they have people also helping to make sure that they do it. And I think people like that, Now, if you have somebody in there by themselves, it's hard, because, unfortunately with home health, you only have so many visits, and you got to make the best use of those visits as you can.
Right.
And it's kind of one of those things, you don't always know how it's going to end up once you're done there. And, hopefully that person isn't, a little abstinent and defiant and refusing to participate. And, then they just don't get any visits, yeah, I mean, it's a good thing when they can see that, hey, you do this is going to be the result, and you're going to be able to keep staying in your home safely. And, even doing a walkthrough to make sure the home is, safely equipped for them, and, helping out with I tell families, Paul, even with like your bathroom, for less than $100, you can almost make the bathroom fall proof, essentially. Put a couple of rails in the shower. If you need a raised toilet seat with a grab bar, you can get that. Get the non-skid, mat for your shower and for the bathroom floor. You just improved your bathroom tremendously for very little bit of money and effort that, likewise, if you don't have it there, poses a huge serious risk where you may not have the ability to make the choice yourself. You may have somebody else make it for you if you have a serious fall and they say, you know what, you're not going to be able to live at home anymore because of X, Y, and Z, or whatever your injury is that you sustained. And that's the worst thing I think you could tell any of us, regardless of your age. Stay in your home as long as you can, but do it safely.
It's very true. I'll share a patient story with you, because I think, this always brings, to life what we do to the folks who haven't accessed services. And we tend to probably learn and remember stories more so than we do words. At least I do. And I think most folks, we had a patient during the pandemic who was a COVID patient and had been in the hospital for roughly a month, and just extremely debilitated, but essentially being bedbound for those 30 days. And the muscle wasting, just the inability to have any kind of strength. We assessed this patient, and honestly, we were a little torn as to whether the patient was kind of moving towards the path of hospice or whether home health was going to be the best option. And we went with home health to see how they would respond to treatment. And the therapists were in the home, doing exactly what you were just talking about, and really just building, some strength. And in the beginning, it's very remedial with some of the things that you're trying to do. It's probably more stretching than it is, building. And then you kind of build off of those blocks over, a couple of months worth of care. And, one of the incredible things was this patient who, the family thought was, much at the end of their life, ended up getting so rehabilitated that, they were able to get them out of the house, and they took some pictures, near the water, by the beach, having lunch. And, and really that was because they allowed the care to come in. But as our clinicians and caregivers that do this type of work, are so mission driven, really find the joy in what they do. Patients love them. They build incredible rapports in such short periods of time. They really become an extension of the family. And I think the experience that folks have is so very positive. And in healthcare, that's not always the case.
Right.
The reality is, how many times have we been to a clinic or to a hospital, and, how did you feel when you left? A lot of times you felt like maybe the experience wasn't extremely positive. But with home health and hospice and private duty home care, patients are extremely thankful for the clinicians that come in. Not only do they say thank you when you leave, but they usually want to know when you're coming back, which
absolutely,
I think really fills the cup of the clinician, and gives them the motivation to want to do better for their patients. And that experience, I just don't know that you really get it in any other setting of healthcare.
I agree completely. We talk to CNAs and caregivers all the time, and one of the main reasons they choose the home healthcare or the home care side of the healthcare industry is because they said, I got into this because I want to care for people, and they mean it in the sense that, nurses, doctors, the aides, everyone in the facilities, hospitals and nursing homes, they do a tremendous job. And I mean, they've been such heroes through this whole pandemic, and even when there's not a pandemic, but they also have multiple people they have to deal with. They don't necessarily always have that time to sit down and console somebody for an hour if that's what it takes, or, make phone calls, help with stuff that, kind of goes outside of the, here's your medication. Let's get you cleaned up. Let's get you clean linen. Here's your fresh ice water. On the home care, home healthcare side, it's a much more intimate, personal experience. Unlike being in a facility or a hospital, you may still get that here and there, but this is day in and day out. I think that's one of the biggest differences. I don't think people feel like they're just a number, because that nurse or that physical therapist or that occupational therapist or that caregiver or that CNA that shows up that day, they're who show up that day. They don't have to run down the hall to help someone else. They're there just for you. You have their undivided attention and their undivided care, and they want to make sure you're taken care of. They want to come in, and if you're having a bad day, make it a better day for you. And like you said, they want to know, okay, when are you coming again? And I think they need that, especially our seniors who may have long distance families and, families scattered all around, or, adult children who are working and grandchildren who are in college. They may not get those, regular visits every week or every other week even. And if they're not, ambulatory, or they're not driving anymore, or whatever the case may be, the only socialization they may get is when those visits come during the week or on the weekend or whenever they have the help coming. And I think that's so healthy just in and of itself, having that interaction with another person. And I think it speaks volumes to the work that the staff do.
I couldn't agree more. I think people use the word holistic probably more than they should. But
Right.
When you think about most healthcare settings, it really is exactly like you said. There is an issue and it's being addressed. And I think, when you're providing care in the home, you have social services, you have all the therapy components. It really is a holistic approach. It's mind, body, and spirit, which, is really important to total wellness, right? Because it's not just about the medication or the treatment or maybe the wound or, whatever it may be that the clinician is there to do clinically. There's so many other things that can impact a patient having a great experience or a better experience with some of those other areas. When we start thinking about all the seniors we've cared for the last year, it's always been an isolated group who in many cases doesn't have a lot of exposure to outside activities. Then you throw the pandemic in there.
Right.
And, when you start thinking about, some of the depression that, has crept in with some of those patients, the ability to speak with the social worker and trying to find creative ways to really make sure people feel like they're engaged and have, purpose is an equal part to wellness. And I think some of those things are things that tend to be able to be addressed in the home, where in a lot of other settings, they're not really focused on, you're not there long enough, for somebody to really address them aggressively enough. So I think all those things are all added perks on top of obviously the clinical treatment that somebody may be receiving.
Absolutely. So Paul, if you could change one thing about the home care, home health care industry, what would you change?
I wish there was more insurance coverage for private duty. That to me seems to be probably the largest challenge that I think a lot of seniors face. We kind of talked about it in the beginning around just the confusion of thinking that Medicare covers, the services that you all provide. It just isn't the case. And there's very few insurance companies that really provide any type of kind of in-home assistance with, some of the activities of daily living. And I think that the ability for insurance companies to do that is going to allow folks to age in place much more effectively. And, I think we all agree that, the most cost-effective environment is to care for individuals in the home.
Right.
And so many times I hear about patients who've had falls and ultimately broken hips, or have had, strokes, and, we're not, being cared for properly. I think that there's a lot of opportunity for us to really improve the care that folks are getting when they may not have a skilled need, but they need help with some of the things that they need to do on a day in and day out basis. I think we can, get better medication management on those patients when there's outside support. We can make sure that the fall risks are being addressed. We can make sure that, folks are eating properly and their nutrition is good, those things keep individuals out of the hospital, and they keep people from having falls. And I think if that's an area that continues to evolve, I think there would be a lot of impact on that across the country.
I agree completely. I know I look for it to change, but I don't know when it will change. And, and just one last thing for us, a lot of families, again, who aren't aware of the industry or the field, then we have to explain in Michigan right now, we're considered a non-licensed, non-regulated state for home care, which is absolutely terrifying to us, and I'm sure others. And, that's one thing I'm kind of waiting for to change, and I realize Michigan's not the only state, it's almost a 50-50 split, but then like our neighbors in Illinois, they are regulated and they are considered a licensed state. And, I'm hoping that that's going to change soon, because I also feel like a lot of people, because there's already such a lack of understanding and education on the field in itself, then you add that component into it where, anybody can represent themselves or say, we're a home care company. What does that mean? So we function and operate with the company as a licensed state as much as we're able to with the resources and tools available. I mean, there's certain things we can't just because it's not a licensed state. So we try to educate people on that aspect too, and I just don't see with the with the baby boomers and the aging population and more people choosing and electing to age in place, why something like that hasn't had happened yet. And so hopefully we're looking forward to seeing that hopefully change in the near future, as well as, Medicare maybe getting an option or a new part to it that will have some guidelines to help fund people being able to stay in place. Because I would just have to think that it would be more financially economical for Medicare to offer that versus somebody who may have, early stage dementia and they can't live on their own. Well, so that just means let's put them in a facility and, Medicare will take care of it. And then you got to get into the Medicaid aspect and things. So I see good things coming. I think, like you've mentioned, the pandemic has maybe shown a light on this industry that may not have gotten there as quick without it. So, we'll have to see what the future holds, but I really appreciate you coming on today. And it was a great conversation and a pleasure to meet you and a privilege to take this time with you to learn more about you and mission care and, home health care.
Well, thank you for having us. Really appreciated the time and great conversation.
Thank you for joining us today at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. We also want to offer another special thanks to Paul VerHoeve of Mission Care for being here today with us and discussing home health care. Please visit us at our website at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can watch or listen to the show on your favorite podcast streaming platforms and our YouTube channel. And make sure to hit that subscribe button. Join us next time on All Home Care Matters as we discuss vascular dementia. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.